Good morning. Hi, this is Sam. Hope you are doing well today. Um, I want to, in this video, I want to talk about my surgeries. And I want to make this a two-part video because I had both hip and both shoulders replaced, and I don't want to make the video way too long. So I'll break it up into covering the hips, and I'll cover the my shoulders on the next video. So let me just get started with the disclaimer. Um, I'm not a doctor, nor I am in any of the medical field with no medical trainings. So everything that I am talking about are simply uh, medical conditions of my own, medical experience of my own, and whatever treatment has been used or treatments that's used on uh, me only, regardless if it's currently or somewhere in the past. So all medications are the one that I've been using or I have been used in the past. So if you need any medical advice or medical questions, please refer that to your doctor. Call your doctor, call your pharmacist for and ask for the advice. Okay, thank you. So basically, I had bilateral hip replacement due to the autoimmune disease is um, way overactive. I know, with a lot of people with autoimmune disease, with ankylosing spondylitis, rheumatoid arthritis, or generally arthritis in general. Not everybody has the same severity. So people who has a minor issue, it can be controlled by possibly diet changes, and some medication will most likely kind of control their conditions. However, for me, the the autoimmune disease is, I believe, is pretty much way overactive, and I am on biologics on it for many years, many years, and a lot of other medications, including um, steroids as well as uh, non-inflammatory drugs. Um, it helps to kind of slow down the progression, but it doesn't stop the progression. So the disease inside my body is still uh, running, so to speak. Um, it's not stopping it. It only kind of slowed it down. So over the times, it damaged on my bones. It still feels my spinal cords. But what I'm talking about today is really the hips. And in my late teens, let's say maybe about 16, 17, say 17, 18 years old, I started having so much pain that I was not able to even stand on my legs, on my feet. Um, I stand up and I have to just stand there for a few minutes before even any movements. Um, During those times, I've been seeing a lot of doctors, and even with going to the Children's Hospital, they first diagnosed me with junior arthritis and then rheumatoid arthritis, and they gave me all these drugs, which some of them is no longer even in the market, like Mobex and Bactria, um, Niprofen. All these are non-inflammatory drugs. Uh, they do help a lot, and that's the earlier years where my bone is still okay, where my there's still some cartilage. So I want to show you what the damage really looks like on the screen here. If you look at here, um, pretty much this is what it really did to my my bones. Um, it basically just eats up all the white part of the bone, and that's the lubrication point where it needs to where the joint needs to move. So it is also called a cartilage, I believe, and you know the medical. Uh, I don't. I believe that's the term where it's called a cartilage. There's no more white bone, and when that happens, you're that the bone looks like a really rough rock, and it's the same on the cup side of the feet, and you're basically just rubbing bone to bone. That's where it hurt tremendously to the point that in my early 20s, um, I'm pretty much I was no longer able to walk, even with the drugs or the biologics. Well, I didn't start biologics until the until pretty much I got my surgery done. So I was just purely on those non-inflammatory, non-steroid inflammatory drugs. So and that caused a whole new problem, and I'll cover those in some other video. So again, it, that's in my late teens is where it starts having issues, and by the time I'm in my 20s, it's gotten to the point that you know these my hips is totally damaged, and if I needed to get you know moving, that is when my the surgery is pretty much my only options. Um, so I had my surgery done in my early 20s, and I do have a really good orthopedic surgeon. He's also a professor. Um, no, he is retired. I don't know if he is still alive now. If he is, he's probably in his 90s right now. But he is really good. Um, I he, all these years he's been a doctor. He said I was I was his youngest patient who had to go um, under a knife to get a replacement for the hips. So the images here, I had both done, as you can see, and I gotta leave to cover the most important area. So I had both of the bilateral hips done, and again, that's in my 20s, one at a time. You can't do both because you need the other leg to walk. So I did it in 1 year apart, and the material that they were using at the time was my doctor told me was some newer materials. Um, so and it will last longer. Now, somewhere down the line, I will have to get another replacement. But my doctor did tell me the newer material versus the old one, the newer one will last at least 15 years plus. The older material, they get about 10 years, 10 to 15 years, and they have to get it replaced. But now I'm going on at least 25 years plus. I already got a good number out of it. And maybe it's because I'm not uh, very active in this sport, and probably most likely a lot of the people who have ankylosing spondylitis or arthritis and you know uh, osteo issues, we're not going to be pretty active anyway. So maybe that kind of help out with the length of time for these before I need to get a new replacement. Again, I was the youngest patient, and here are the what the actual material uh, is. This is the stem that needs to go all the way into inside the bone. inside the bone, and the cup the cup gets screwed uh, to the pelvis bone in there. It looks actually quite scary, and this is actually my own uh, X-ray. Um, I just had this X-ray done a week ago for for my new orthopedic, which I am looking into now, a new orthopedic, and have them take a look at it to see um, if it's time for me to get a replacement yet. Um, so these materials are actually made of titanium, and it's not. You don't have to worry about getting them magnetic on it. I got really worried the first time um, I had other issues and I need to do an MRI, and I thought I was gonna be in the MRI tube when they fire up the machine. I'll be lifted up into the top of the machine or whatever that they'll be bouncing me around with the metal and probably yanked it out. I got really anxious, but they told me the titanium part is fine. So it is a concern when there's metal parts in your body, and it's not only that. Uh, when you're going traveling, when you're going to the airports, I guarantee you, you don't have even have to let the machine beep first. You just tell them, I just walk in there and I tell them that I have metals in my body, and I just put my hands up, and then they do check you uh, physically with a little thingy or so. So again, this is what it's like, and this is the a drawing of what the surgery and the insert is like. Um, the key part of really getting these done is make sure that the doctors, your rheumatologists, gave you the correct diagnose, refer you to a great orthopedic surgeon, and I did have it done in a great place in a great hospital, um, very well taken care of. I had my left done in the beginning. I believe, I don't know, very early in the 90s. I don't remember the exact year, 94, 95, 96. I don't remember. And the right following that. So when the doctors had arranged my surgery, um, that the on the left hip only, that's the first surgery. 2 months prior to that, the doctor said, or the hospital actually said, I need to go draw my own blood, which I did. So it took 2 months for. They said 1 month you go there, draw 1 pint, a big bag like that. Uh, and by the time I was done, I was pretty weak and pretty dizzy. That it's a lot of blood that came out of a body. Um, done that for 2 months. One bag 1 month, and then you got to wait another month to for the body to recover until you draw the other bag another month. So the surgery was set on like a third or the fourth month, and bloods can be kept for only a few months, no longer than that. I think I don't know, like 6 months or so. So the hospital will keep your blood in a blood bank until the surgery time and to see if you need it. And that's only on the first time they actually done that. And the second surgery on my right feet, they did not ask me to do the same. I don't know why. Um, so prior to the surgery, a lot of the medication has to be stopped. The non-inflammatory, non-steroid inflammatory drugs needs to be stopped. I believe quite a few days before that, if taking any blood thinners, it's got to stop way before that. Um, yeah, and then drugs need to be stopped from 1 week to a few days before, depending on what kind of drug. The hospital, I mean, the doctor will let you know. The actual surgery, if I remember correctly, doctor said it'd take 4 to 6, and I believe it actually got used up about maybe 5 to 6 hours, and it did take pretty long. It's a pretty big procedure. Um, was in the hospital in the ICU for 2 days for the left hip. Everything went very well. The right leg is when I had some issues. I believe I was in ICU for about 4 days. On the second day, my blood pressure got dropped too low, and I had 2 bags of blood transfusion. So, what was interesting was the first hip a year ago, it went fine. I'd drawn the blood getting ready for my surgery. I didn't need it. The second time, they did not ask me to draw my own blood, and I had complications. And they have to get two bags of blood from the blood bank, somebody else's blood, uh, and transfuse that into my body. So yeah, go figure. They said getting your own blood is the most compatible. You gotta make sure it's the same type and all that stuff, and you don't want to make sure that there's no other uh, issues, other diseases that other people have, and I don't know if has anything, but I'm fine after that. So luckily, after a few days in the ICU, everything got um, moved back to normal, and I was back into the regular rooms. So the first time I was in the hospital for about 8 days, and the second time I was in the hospital maybe I think it was 9 to 10 days because of the complication. It actually took a little longer. The full process of recovery of my hip took me from 6 to 9 months before I felt like uh, the feet was normal and I can walk and jump and run freely with it. So it did took that long, and a lot of physical therapy, a lot of physical therapy, from minor to much tougher therapies to get the feet stronger so you can walk. And with the in the hospital, IV bags, antibiotics after. Pretty much that's the most important part. Making sure that you're not going to get infection from the surgery. That's um, I got a lot. I don't remember how many. It's one bag after another for many days. Pain medications, and that is pretty much a must. It was a big surgery. It was a huge cut. I believe the cut was about maybe this big on my feet, on the side of my of my hip, um, about 10 inches long at least. The scarf is still there. Uh, I think the hospital, the standard painkillers are either morphines or oxycodone. I believe I was taking morphine. I was high. I was really high. Yeah, it's good stuff, but don't get it for no reason. Okay. Uh, so yeah, IV to keep me from dehydration because I was not able to eat. Antibiotic for infections. The painkillers and all that, and um, ice help reduce inflammation. A lot of ice packs will work. So here's my process of really on the recovery process. So week 1 and 2, a hospital cannot um, stand on the feet. Basically, I was the body was just elevating it. Cannot put the feet on the floor. But the nurses in the hospital will get you up out of the bed to do some movement, so you cannot be in bed for the whole 2 week. That's bad for the body. But they do help me move around in the room with a walker. And thereafter, I got discharged. Go home. Week 3 and 4, I went home with a with some with a cane and also a walker, a cane, crutches. Crutches is what I used for the most length of time. Walker was only for like the first couple of weeks. Um, Week 3 and 4 on crutches, I was able to tap my feet, just gently tap my feet on the floor, just kind of get the feel that my feet is touching something. So that's week 3 and 4, and there are light physical therapies, kind of squeeze the muscle, uh, minor movement from side to side, front and back. If I'm standing, you kind of like a swing, move your feet to help get movements. Um, on week 5 and 6, put a quarter of the weight on the feet. I was able to put a little bit on. I can feel that it feels very, very different because I haven't put my feet on the floor for so long. And the first time I put it on with weight, it felt very different, particularly when I had the surgery. The original bone was not there anymore. It's artificial. It felt very, very different. Um, and then more therapies, more muscle flexing, more movements, and uh, that all with the help of with the both crutches. So on week 7 and 8, again, more weight on it, same process, more weight, more physical therapy. 9 and 10, pretty much the same. The physical therapy part actually increases with a lot of rubber band, trying to pull weights on and stretch to improve muscle on the hip. Um, by week 11 and 12, full weight. I can put the full weight of my body. Um, you still need to stand on crutches. Basically, just kind of elevate yourself, but you can stand on it with the full weight. You don't need to lift, push myself up on crutches, but full weight standing on it. Again, it feels good. It feels different. Um, it still feel very different. It's not 100% good yet because I know I was not able to walk. If I do without the crutches, um, the balance is not there. Um, so on the next 2 weeks, anywhere from my 13 to week 13 to 16 ish, the next month, I was able to ditch the crutches and just use canes. And I can felt that I kind of tilt myself to one side where the energy on the left. When you walk, you're kind of like using the cane to give you support, um, to keep myself balanced. But I was able to walk just with the cane. So actually felt pretty good at that time. So yeah, a lot of improvement. So from there on, uh, another month or at least a month or two on a cane. At that time, you could pretty much go anywhere. You can go out. You can go do some light activities, um, walking. They want you to walk more by then. And again, by 6 months to 9 months is where slowly you get used to the new hip, uh, removing the even with the cane, no more cane by 6 to 9 months. So it's just getting used to, it's like a baby starting to walk again. Um, yeah, it completely take a full 9 months. By 9 months, everything's pretty much fine. Everything's just felt normal. The feet it just felt normal. Not, I don't feel the like it's new anymore. So like I said, the full coverage it actually took a good 9 months, and by then I was able to walk and run if I can. Even minor sports, it doesn't affect it, but still, doctor said you need to uh, keep moving to get energies on the feet, and it's really kind of bond together by your body muscles only. It's just like a cup that just stands on here, and if the muscles is loosened, it can drop. So yeah, so that's my experience with my hip replacement. And the process of going through it, it actually took a lot of time, a lot of patience. Not much to do at home. Read a book. I read a lot of books during those time when I was in bed. Um, Again, computer was not that popular at the time. No iPhones, no smartphones, no tablets. Books, physical books, magazines. Order some magazines from the health, learning about the arthritis, autoimmune, ankylosing spondylitis from physical magazines, not computers. So a lot of reading for me. Yeah. So, um, how many people uh, actually are thinking about or needing to get a hip replacement? And I don't know how many of you are actually severe enough and caused by the autoimmune disease. And if yours is your situation is kind of the same point as mine, where my autoimmune disease is pretty much way overactive. The disease is still progressing in the body. Um, Basically, I have the balance between the risk and the benefits, and there really doesn't seem uh, any way of saying the risk uh, um, is more than the benefits at that time, because if I can't move my feet, I'm pretty much disabled. So not to mention just one, it's at both of my feet. So uh, it was pretty easy for me to say yes to the surgery. I didn't really have to think twice. So again, uh, make sure you work with if you have to go through it, work with your doctors, ask them for everything on the ins and outs, the recovery period, what to expect. They'll give you everything. That's everything I have was my experience from week one to week to 9 months. It's a slow process. Um, but once you get through it, it's like a brand new hip. The pains are gone, but of course the arthritis is still there. The ankylosing spondylitis is still there, causing other issues, but the hips are totally brand new, totally fine. Um, but again, in overtimes, I do need a new replacement. I don't know when yet. Possibly in the next 5 years. I don't want to have to wait till I get too old. Then it will create a whole new complication because going through a major surgery like that, um, the older you are, the worse recovery time. So yeah, so I am gonna see a new orthopedic surgeon pretty soon in the next couple of months, and we'll take a look at these X-rays, and I'll pretty much gonna go from there. Now I don't hope any of you guys have to go through all that. That's pretty tough, but again, if you must, make sure you talk to your doctor. Again, the key is to make sure you do this in a pretty well-known hospital with some great doctors. It The outcome is very different. So anyway, this is all for this particular video. It's about my experience with the surgery of the hips, and I'll talk about the surgery for the shoulders in the next video. So again, that's it for this video. Thank you for watching. Um, if you like the video, please give me a like and subscribe. I will come out with more videos about how I gone through um, my own medical adventure. So if you can give me a like, would be great. Help out the video with the algorithm. Uh, Subscribe would help out my channel as well. So hopefully let's all find a better days together. Thank you for watching. Have a good day. Take care.